Yes, sir. Audible, sir.
I think it will be much better now, the voice part. Okay, so let me share my screen with all of you once, then we can start. So what we will do, today we will do the ROC part. So like today what we will do, we will finish up two important part that will be your ROCs and the correlation part. Done. Now we are touching some kind of advanced analysis. This is not a simple part. So I need your proper attention for these two topics. And for tomorrow we will do two things. One more, that will be your regression part, and by using the Kaplan-Meier analysis part to check the survival and the log rank p values as well. So today's class will be very important for all of my PGs and PhD, whoever is doing like the cutoff part, whatever the correlation part and all those things. Done. So please let me know if you can see my screen. Okay, I hope you all can see my screen now. Visible? Yes or no? Please be quick. Visible to all? Okay. Now today what we are doing, we are first topic what we are starting is the correlation analysis part. Remember, two important parts. Now, what we all should know, we have to apply correlation whenever we are looking for the positive or negative correlation between two different variables. As per the principles, this can be continuous or continuous variables. It can be continuous or nominal data. So for this type of part, you can apply the correlation analysis. But remember, we can't apply correlation for the categorical versus categorical data. Not possible. We can apply only for continuous or continuous versus nominal data. Remember this part. Done. Now, if I talk about the positive correlation, if I talk about the negative correlation, the major difference between these two parts is like what? What we can notice among the lab data, among the disease part. Let's make it very simple to all of you. Suppose one patient is coming to you having high fever, high bacterial load, high bacterial load. So what will be the effect on the total count or WBCs? Anyone who will answer me this question? So if your bacterial load is increasing, what about your TC or WBC count or neutrophil count? Mostly increases, correct? So now, if bacterial load is increasing, automatically with the increase of bacterial load, your TC or WBC also increases. This is what known as positive correlation. Remember the simple part. Done. If one goes up, other also goes up. This is what a positive correlation. Done. Let's take one more example. Suppose we have a patient with a viral infection. Done. Or let's make it very simple for all of you. Suppose we have one patient with the liver failure or with some kind of liver problem like CKD, sorry, like CLD, liver cirrhosis, HCC, all those things. What about the albumin levels? Anyone? Suppose liver injury is increases. So what will happen to your serum albumin? Answer me. Decrease. Perfect. So one goes up, the other comes down. This will be known as what? A negative correlation. Done. Do I have a slide? No. Okay. So we will get few important graphs for this thing. I will show you few most important graphs. Done. One graph will show your data like this, like this. Another might be like this. Correct? Your data, as per the Spearman Pearson values, your data might go like this also, might go like this also. Correct? Same way for this part, like this or like this. Just give me 2 minutes. Ah, yes, sorry. Now again, if I go back to my principles, if you are seeing that in any case, like uh suppose this is A, this is B, this is C. Again, this is A, this is B, this is C. If anything is going from below to above, like in this direction, or something is coming from above to below in this direction, that will be what? A classical positive and negative correlation. Then in the scatter plot, we always appreciate some presence of some dots also near to a line also. That is what your data. This will be your data points, whatever we are holding for the analysis. Then now, if I talk about the test, what we should usually apply, we have two type of tests. Okay, let me have some clear slide. Okay, so let me take some clear slide for all of you. I will remove all these things. Now remember, if your data is clear and stable, correct. If your data is stable, what we have to do, we have to apply a Pearson correlation. Pearson correlation. Done. In the case if data is stable. Suppose if data is not stable, it's highly unstable, or your Shapiro-Wilk test, Cole-Mogorov test is coming significant, we have to apply what? A Spearman correlation. Spearman correlation. Done. Two simple things. Remember this part. If data is stable, you have to apply what? A Pearson correlation. If not, then apply the Spearman correlation. In the case of anything, whatever you are performing, like Spearman or the Pearson correlation, our cutoff range is like almost same to same. Suppose if it is from 0 to 1.0, sorry, my mistake, not 1.0. Suppose if it is from, wait, let me remove. If it is from 0 to 0.10, this will be your negligible correlation. Done. Then we have suppose 0.11 to 0.30. This will be your weak correlation. Suppose I'm taking 0.31 to 0.50. This will be what? Your moderate correlation. Done. Suppose if I'm taking 0.51 to 0.70, this will be your strong correlation. If we have data, suppose from 0.71 to 1.00, exact 1.0, this will be what? A very strong correlation. Done. Now, in the textbooks, in the Google, in any analysis book, you will see a numbers with signs also, like this. And same for this part as well. You will notice all these things. Then, now this is what. Suppose if in the analysis part, it is showing me a value of suppose 0, minus 0.422. That means this is what? Anyone? Any guesses? This is what? A negatively associated. But how much? So I can say it is 0.422. That means what? Moderate. That means this is what? A negative moderate correlation. That means if your A value is increases, your B value is decreases. That means we do have some kind of correlation between these two variables. If you can recall the numbers 0 to 1.0, this is like negligible correlation. Then we have 0.11 to zero point 0.3, that will be your weak correlation. If we have 0.31 to zero point 0.5, this will be your moderate. 0.51 to zero point 0.7, this will be your strong. And same for the 0.71 to 1.0, it will be what? Your very strong correlation. Then, irrespective of the signs we are discussing now, but in the analysis part, we are going to get one sign data also, plus or minus. Then, if it is minus, this will be moderate negative correlation. If it is like suppose positive, this will be what? A positive moderate correlation. Done. The sign will change this part, positive and negative, but interpretation will be same with respect to interpretation values and the data. Moderate, strong, positive, strong, negative, strong. That's it. Done. Do we have any doubts, any questions now? Anyone? Anyone? Doubts? Questions? Anyone? Please be quick. All fine till here. Perfect. No? Others? No? That's actually a good sign. Now, again, two things might be possible. Either I am a very good teacher or like entire things are like going above your head. I'm not sure because no questions is actually a good thing for me. So like, please be honest with me. Please be honest. Like all you are getting proper things. Like any doubts, any questions? Thank you, Dr. Prasad. Thank you. Like no doubts to everyone. Everything is fine till now. Anirudh, Dr. Varshini, Swami, Pareen, Medapati, anyone. Nisha, Ria, Seema, Sujata. No one? Okay, fine, no issue. Now remember, let me discuss this part as well with you all, a proper graphical presentation, how graphs will come up. For this part, always remember we have to check the scatter plot whenever we are checking for the correlation part. Scatter plot are very nice. So they look like this and your data might look like a small dots, correct? And you might get one line also in between. Your line might appear look like this also, like this. Right, done. So if your line is going from below to above, that means this is what a positive correlation. Done. If it is coming, suppose from above to below, let me draw one more graph for you all. Suppose if your graph is coming like in this way, suppose like this. Done. Your graph is traveling from above to lower side. This will be what? Your negative correlation. Done. Simple, everyone. For the graphical presentation, if it is going from below to above, this is what your positive. If it is coming from above to below, that will be your negative correlation. Simple analysis. Done. Now we will practice this part in the SPSS also after completing the ROC part. Okay. Now the next thing what we have is the ROC analysis part, that is the receiver operating characteristics. Suppose in the WHO guidelines, correct? So what we usually follow, like if your hemoglobin is less than 7, we have to start the blood transfusion protocol. Correct me, Dr. Prasad, if I'm wrong. Correct? If your hemoglobin is less than 7, we have to start the blood transfusion protocol among such patients. Done. This cutoff we got from which analysis? This is the receiver operating characteristics. Suppose your HPSAG antibody, your viral load is more than 20,000. We have to start the antiviral therapy. This cutoff came from which part? None. Suppose your total bilirubin is more than 5. Your patient might be having the ACLF. This cutoff came from which part? This is the receiver operating characteristics. Then whatever guidelines we are following, whatever studies we are looking at for diagnosis part, we are might be coming up with the cutoffs. If your patient is having hemoglobin level of less than 7, more than 10, more than 15, more than 20, anything might be a risk of developing this XYZ disease. That cutoff we are getting from the receiver operating characteristics. Remember this part. Then in the clinical practice, whenever we are always using the ROC part, we always have to check the AUC. Sorry, we always have to check the AUC. AUC is what? Area under curve. Done. So as per the test books, this is like if it is more than 0.70 or more than 70%, this is like what? A medically acceptable data. Correct? This data we can practice in the medical field also if your AUC is more than 70% or equal to 70%. Done. If it is going above 70%, it is changing from acceptable, highly appreciable, all these things. Done. If it is below 70%, not sure what is the issue with this sometimes. If it is less than 70%, up to 60, it's manageable. Less than 50, 50 things will happen now. We might accept, we might not accept the ROC part. It might not even go for the publication part as well. Big problem. So if you have more than 60 R AUC part, automatically your things will be very much stable. The next thing what we all should know is the sensitivity. Sensitivity, specificity. Can somebody answer these questions? This is what and this is what. Anyone? Suppose this is 90.
Sensitivity is
Suppose
to
this is,
find out the
tell me.
sir, to find out the true positives, we use sensitivity, and to find out the false true negatives, we use
Okay, so what
specifics.
is true positive?
So the test is positive when the person actually has the disease.
Okay, tell me. MRI showed cancer. Ultrasound showed cancer. This is what?
They said this both the tests are yielding the same result. So obviously, if MRI is showing cancer, so it is sensitive to them.
Like this is what? True positive, true negative, the what?
True positive, true positive.
True positive. Perfect. Suppose, uh, let me make it more complex for all of you. Everyone, this is very important. Very, very important. Done. MRI showing cancer. Ultrasound showed no cancer. Then this will be what? Dr. Prasad?
Sir, MRI is the gold standard, right? So if it is showing cancer, the person has the disease.
Correct.
So
Perfect. This is the answer only. So whenever we are doing the analysis for the ROC, we always have to ask like which is the main golden standard test. In the radiology, they might be taking biopsy result as the golden standard. Correct. So always you have to ask like which test you are taking as a golden standard. And with respect to that part, we have to compare the other available data. Done. Now suppose in this case, MRI is showing cancer, ultrasound showed no cancer. MRI will be always a golden standard compared to ultrasound. If ultrasound showed no cancer, MRI showed cancer, this will be what? False positive. Correct. Now suppose MRI, sorry, let me remove rubber also. Okay, I will remove few important parts. Okay, suppose MRI showing no cancer, ultrasound showed cancer. Then this will be what?
sir, can you specify if the person has the disease or not? Like,
Okay, MRI no cancer, ultrasound showed cancer. In a same patient, suppose in a same patient, Dr. Prasad, MRI showing no cancer, everything is fine, ultrasound showed cancer.
there is no disease in the person.
This will be what? A false positive.
Yes.
Correct. What we have only four simple variables. We have first false positive, then we have false negative, true positive, and true negative. Simple. We don't have any other variables out of it. So what is false positive? In this part, if you can see, MRI is what? A golden standard. What about the ultrasound? It is showing cancer. What about MRI? No cancer. This is what? A false positive. Suppose both are showing cancer and cancer. This will be what? A true positive. Suppose both of them are showing no cancer, no cancer. This will be what? A true negative. Done? Simple way. So always ask which will be your golden standard and which will be your testing variable or the modality for the testing, ultrasound, pathology, anything. Done? What about the sensitivity now? Out of 100, if it is showing suppose 90%, that means your diagnostic method out of 100, 90 patients can be correctly diagnosed with the diagnosis part, whatever you are using, ultrasound, MRI, all those things. What about the specificity? Suppose it is coming 80%. That means out of 100, 80 patients will be correctly diagnosed as disease free. Done? Anyone doubts, questions? Anyone? Actually, I need one more slide. What can I do? Can I remove this diagram? Okay, I cannot remove. Okay. So what can we do? Any blank slide?
Use the previous slides and erase it from eraser.
Ah, yes, perfect. This we can remove. Okay. See everyone, whenever we are having data in the continuous way, our work is very, very easy. Whenever we are trying to find the data like sensitivity, accuracy, spec part, the sensitivity part, PPV and PV part, accuracy part in the categorical format, you should always ask like which is your golden standard test, correct? Suppose I'm having uh, MRI. I'm not sure what is the problem. MRI and the ultrasound, correct? MRI will always be your golden standard test compared to ultrasound, correct? MRI showing a cancer is positive, ultrasound show cancer is positive. This will be what? Your true positive. Done? Both are matching, true positive. Suppose MRI showed cancer positive, ultrasound showed cancer negative. This will be what? Anyone? This will be what? A false
False
negative?
negative, false negative.
Perfect. Let's take one more example. MRI showed no cancer, ultrasound showed cancer. Then this will be what?
False positive.
Perfect. False positive. Suppose MRI showed cancer negative, ultrasound showed cancer negative. This will be what?
True negatives.
Perfect. This is true negative. Done. And this is how you can calculate manually. Nowadays, we have available online calculators to find the sensitivity, specificity, accuracy, PPV, and PV, all those parts. Done. Now coming to our data in the numerical format. Done. Whenever we are having data, suppose lab data, I want to find this specific cutoff for this diagnosis part, suppose a live dead, our work is very, very easy. Why? Because we will get this type of analysis on our SPSS, JAMOV, EZR, anything. Then this is known as ROC analysis. This is what ROC actually looks like. Now, in the center, I hope you all can appreciate this gray color line. Let me color it back for you. This line. Done. This line is what? Your reference line. This is what? Your reference line. Done. So automatically, what we all should know, all the data, whatever we are putting should be above a reference line. It should not be below a reference line. I have seen many people, they are practicing in this way. So what they are doing, they are putting all the numbers in a single ROC. We are getting a ROC with both the ways lines, which is not a practical possible thing, which is not a good practice. Done. Remember, your ROC line should be above the reference line, even though if it is more or less. Now, suppose you are not sure what is going to happen with the lab data in the case of my event. So what we can do, blindly apply the ROC part. Let's see what happens. We will see later on. No issue. Some lines will appear below the reference line like this. That means this data is like what? Lower value indicate more positive test. Correct? If it is above, this is like what? Higher the value, more the positive test. For example, suppose I am checking a amount of albumin in the case of what? A liver disease. Correct? So in the analysis part, we have options to select, like higher value indicate positive test, or lower or smaller number indicate more positive test. So I know in the case of liver disease, this will be lower. So I have to tick on the lower value indicate more positive test. Done. Automatically, my this part will come in the above way, like this. Done. If I'm not sure like what is going to happen, automatically SPSS will always give you by default upper or the higher value indicate more positive test. In that case, what is going to happen? Your ALB value will be below the reference line. That means that data will deviate from the analysis part. Done. So this is what how ROC will go like. Luckily, we got MedCalc when we were handling a very previous or old versions of SPSS. MedCal was giving us a calculative sensitivity cutoff and the spec value also. But some people were like not having the access to medical, so they were practicing in the SPSS only, or Jamovi part as well, or EZR part as well. Now, if suppose you don't have a proper resources and you got the ROC, so how to calculate a sensitivity, specificity, and the cutoff with the help of this graph only? One problem done. So apart from this graph, you will get one more big table containing cutoff, sensitivity, and the spec part. Done. So how to calculate which number I have to select in the tables? Done with the help of this ROC. So initial like very old days, what we used to do, we used to draw a line from this one to one, like this part, first line. Done. Suppose if I'm taking this AOC part, this gray color line, next time will be what? We have to see this center line is cutting at which point in this gray line. Okay. So I can say, okay, from this to this part, one, and the other line is where? From, sorry, my mistake. Okay. Now, one is like from this to this part, the other is from this to this part. Done. Now we have to manually match. Okay, this is coming nearby 0.75. This is like more touching 0.25. Okay, my data will be somewhere in like in this range only. Like a big table will come. At that part, we have to manually check like this numbers are matching with this part or this part, and then we will report a cutoff. Okay, with this part, this will be more than equal to 0.28 as the potential predictor for the disease outcome. But luckily nowadays, what is happening? We are actually getting the cutoff also. And with that cutoff, we can actually supplement and we can check which numbers we have to report. That's it. So like now things are very easy. So like, do we have any doubts or questions with respect to ROC part? So I just showed you like in the old days how we used to calculate the ROC part manually with the help of scale, but now everything is very well. So now do we have any doubts, any questions with respect to ROC? Anyone? Doubts, questions? Uh, I was unable to clearly understand above reference line and below it. Can you please take part again? Okay, sure. Okay, let me remove this part. Actually, my mistake. I could have taken plain graph. Okay. Now suppose this is your ROC, what we are getting. Done. This line in the center, what we got from this to this. Done. This will be known as your reference line. Done. One part is done. Correct. In the SPSS, Jamovi, EZR, RStudio, any application, whatever you are using, it will give you two options. One option will be higher value indicate positive result. Other option will be lower value indicate positive result. In SPSS, it might be suppose larger or the smaller value. Language might change, but we have a same in. Correct? In some disease, what happen? In some events, what happens? Some lab data will eventually increase. That makes more sense to us. In some disease, some lab data will start to decrease. Correct? Suppose in the case of sick kidney disease, suppose I am taking a renal problem. Done. In this part, I know if kidney is getting more damage, our creatinine level will start to increase. Done. This is well known. What about the EGFR? EGFR will start to decrease. Done. In certain conditions, some lab data will start to go up. In certain condition, data will start to come down. Done. I hope this part is done till now. Dr. Prasad,
Yes, sir. Yes, sir. Till now,
done.
it's
Now,
yes,
whenever
sir.
we are getting these lines above the reference line, this is the actual good practice. Don't practice in a wrong way. Don't give all sort of data in a single ROC. Done. Your ROC lines should be above the reference line. Should be above the reference line. Done. We have to select the option like what we are actually looking for, higher value or lower value. Done. So as per that part, we have to select the option and we have to run the analysis part. Done. Now suppose I selected higher value indicate more positive results and I got all the lines above the reference line. This is actually a good practice. Done. This means whatever cutoffs I will get now will be more than equal to at certain value. Suppose for this red part, we got a cutoff of 10.54, for example. That means if your value for hemoglobin is more than equal to 10.54, the outcome will happen among such patients. Done? Remember this part. Suppose I want to look for in the liver failure patient, at which level of albumin you will have more mortality. Okay, I will select lower value indicate more positive result. I got my suppose like this part ROC and my cutoff is like what less than equal to 0.04% or any unit. So I can say okay, if your patient is having a serum ALB level of less than equal to 0.04, they might be having more mortality. So from this part, we will get one exact cutoff. Done? Doubts, questions now? Anyone? Dr. Prasad, doubts?
So that was clear. Thank you.
Like, sorry, what? I didn't catch you. What?
I was saying thank you, sir. Thank you.
Okay,
Taking
okay,
up the
okay.
question.
Okay. So let me come to SPSS. It will make your doubts more clear afterwards. Others, doubts, questions. Anyone? Anyone? Doubts, question? Yes, whatever you are doing, your higher value, lower value should be always above the reference line. Always, always above the reference line. Done? Doubts? Questions? Anyone? Doubts? If no, then I think we can come to our SPSS. Okay. I think there is no doubt. So I will stop my screen share. Then we will go to SPSS. Okay. I hope you all can see my screen now. Visible to all? Visible to all? Ah, same, Dr. Prasad, same part. The problem is today we have to do the regression part. The problem is even though I have like thousands of Excel, but I can't share without any consent. So I'm just waiting for some consents, then I will share those Excels with you as well. In that part, we can actually practice the regression part, the odd ratio parts. Done, everyone? Yes, of course. I'm just waiting for some consents. So that's why I shifted this class to this topics, ROC and the correlation part. But no issue. Let's see tomorrow what I can do. Okay. The first part, what we will do, we will open our sheet. The first thing what we are looking at is the correlation part. Go to Excel. Everyone, please open your paired sample t-test. Click on open. You will get this type of screen. Click on OK. This will import data to your SPSS. Now this is the same sheet what we were looking for in the last class about the Wilcoxon test. Now I know there is some significant effect was coming up between my pre and post test. Do we have any sort of correlation part between this thing? Anything is involved? One thing is like what is the duration of disease part. Then this is well obvious. Whenever we have a patient with more number of disease duration, such patients have more amount of disease knowledge compared to what a freshly diagnosed patient. Then suppose we have one patient of age 50 having diabetes since last 20 years, automatically he or she will have a more amount of knowledge with respect to diabetes and drug part and insulin part. Suppose you got a very fast patient today with diabetes, automatically he or she will have a very less amount of disease knowledge with respect to diabetic management, with respect to injection part as well. So I just need to know, like, do we have any correlation between that disease duration and the pre-test score? Even though we have some patients with score of 20, 12, 14, 16, 12. So how to check this correlation? Remember, this data is what in the numeric form. I can change to scale as well. Principle is what? Continuous versus continuous, nominal versus continuous. Now, how to apply correlation part in the SPSS? Go to analyze, go to correlate, go to bivariate. Three simple steps: analyze, correlate, and bivariate. Click on this part. What I will do, I will just select duration and pre-test to this variable part. Ignore all these options. Then we have this two options, Pearson and the Spearman part. If data is stable, apply Pearson. If not, apply the Spearman. Kendall tau, you might notice more in the terms of meta-analysis with respect to chi-square also. Kendall tau B. So if you are practicing a meta-analysis part, you might noticing a Kendall tau or tau B value in your Raman application. But as such of now, not required. I can ignore. Suppose this data is not equally distributed. I have to go with the Spearman. I have to remove the Pearson part. Then click on OK. Okay. What I'm getting with disease duration and duration, it is 1.000. This we always have to ignore. What about duration and the pre-test? It is showing a Spearman value of positive 0.498 with a p-value of less than 0.001. So this is what? Anyone? This is showing what?
Moderate positive correlation.
Correct. This is showing a moderate positive correlation between the disease duration and the pre-test score. So I can say, okay, with this data, I can say if your patient is having a more disease duration, automatically he or she will have more amount of disease score or like knowledge. Done. So this is how you check the correlation part. One more thing I will share with you. If we want, we can go to graphs, we can go to chart builder, and we can make a graph here also with respect to scatter dot. Then just select a graph of your interest part. Then just transfer your pre-test, suppose in this part. Suppose I'm taking this part, this part. So automatically I will get one graph like this. This is not a Pleasant graph. I will never use this graph for my data reporting part. So for correlation part, I always use Jamovi. So Jamovi look like this part. Done. I use Jamovi just for the scatter plot because I love the diagram, whatever it is giving to me. So I will show you how diagrams will look like in the Jamovi part. Suppose if I am taking duration and pre-test, suppose for this part, if I select, I will go to Jamovi, I will paste here, go to A, this is what my disease duration. Best part is about Jamovi part, it allow me a space characteristics also. In SPSS, we can't put space. B is what, suppose my pre-score, I can change to continuous. Same for this part, I can continuous. This is just for learning sake, okay? Now, exploration, scatter plot, disease, y-axis. See, this is my graph, done. This is my data, what I was holding. Click on linear part, it will give me this part. A line, a very beautiful graph. Done. If I want, I can put this densities also. Sorry, not for this part. I will remove marginal. Not require box plot also. See, see, a very nice graph, a very beautiful graph compared to SPSS. If I see this graph and if I see this graph in the SPSS, graph chart builder, if I take scatter plot, if I put here, let me take values also, disease duration, my pre-test score. See, this graph versus this graph, which is better? So like, can you all appreciate this thing? Like we got some much better graphs in the Jamovi compared to SPSS. That's why I don't use SPSS for the graphical presentation. Done. So like this was completely for learning purpose. We are not teaching Jamovi for this part, but you should know like where we can actually go for a better graphical presentation. If you are suppose holding a Prisma with you, you can practice in Prisma also. But in Prisma, we don't get the proper scatter plot. That's why I prefer Jamovi for the scatter plot diagrams. But okay, coming back to our SPSS. So this is how we have to perform our Spearman and the Pearson correlation. I hope this part is clear. Anyone? Any doubts? Any questions? Anyone?
Sir, I wanted to ask you one thing.
Ah, yes, please.
Sir, in the ROC curve, we plot the curve for sensitivity versus 1 minus specificity, right?
Correct, correct.
So, sir, what were we doing in the previous case? So, can you explain it in that terms as well?
I will come to that part. I will give some different sort of data for this thing.
Okay,
See,
so
in this
thank you.
data, no, we can't apply the ROC part first of all. This is not suitable data for ROC because I don't have any event for this part. Correct. I was just
Yes, sir.
having the duration of disease, pre-test, post-test. I am not holding any sort of event like blood transfusion, alive, death, case versus control, UG versus PG. Nothing is there. So this data is not actually applicable for the this part, ROC part. So what we can do, I will give you a new sort of data for the ROC practice and I will show you all the steps. So what we can do, we can start the ROC now. Go to file, go to open, go to data, change to Excel. Everyone please open the statistical analysis class practice sheet. Everyone please open this part. Click on open and this will be your Excel, your SPSS for the practice sheet. Now, this is what my case versus control. Done in this part, I need to look for my cases, my control, and what are the potential predictors for the case group. Suppose case is what? Liver cirrhosis patients with portal hypertension. What is my control group? Liver cirrhosis patients without portal, like a portal thrombosis. So my event is what? Portal thrombosis in the liver cirrhosis patient. My one is case. Case group is what? Liver cirrhosis with portal thrombosis. Two is what? Control patients, liver cirrhosis without portal vein thrombosis. I need to know what are the potential predictors for the portal vein thrombosis. So what I will do, I am holding a lot of data, correct? All data. If any one of you is practicing a statistical part or guiding some UG/PG people, remember, always tell them to collect all the possible data for CBC, LFT, RFT. Don't skip any data. Nothing. Take all things in one shot. Done. Suppose I'm thinking MPV, PCT, distribution width, TLC might be a potential predictors for the portal vein thrombosis. So how to apply ROC? Go to analyze. In the older versions of SPSS, in the last option we have ROC, or else in the new version we have classify. Go to ROC analysis. Simple steps. Analyze, classify, ROC analysis. Done. Click on this part. Now, what is my state variable? I want to look for case versus control, select. And in the case versus control, what is my main predictor? Like what is my main group? That is my case group. I want to know the potential predictors in the case group compared to control. That's why select your groups, select the number of your interest. Done. Next step, suppose I want to look for, suppose hemoglobin. Uh, okay, just for learning sake, suppose hemoglobin HCT, I will take some other values as well. Suppose I am taking ALB count, I am taking total protein as well, and I am taking suppose this data as well, just for learning sake. Okay, I've not made that much complex. I will take this much only.
Sir, I
Transfer.
could not find the ROC.
ROC, this
Can
will
you?
be in classify, analyze, classify, and this last option.
That's
Got no?
okay, sir. Let me try that. Okay.
Analyze, classify,
Yes,
analysis.
yes, sir. Yes, sir. Yes, sir.
Done. In the
Thank
older
you.
versions, Dr. Prashad, in the very older version, we have a separate option in the last ROC, here only. But now we have to go to classify and the ROC analysis. Now we have to select our state variable. What is our interest? That is case versus control, transfer. In the case versus control, which is your more important part? My case, code is 1. Done. Now the variables I need to check for as the potential predictors. I will take just for learning sake hemoglobin, MCV. I will take suppose this part. I will take ALB and total protein to a test variables. If I go to option, now see test direction. Larger test result indicate more positive test. Smaller test result indicate more positive test. Suppose I am not sure now what is going to happen. Let it be on the larger part. Click on continue. Go to display. Click on all the things. Then I think in the newer versions of the ROC, we have one more thing that is the Udin index, which is not a part of my version. Then click on continue, click on OK. Now this is the ROC what we got. A very beautiful ROCs actually. Now this is what a red line in the center. This is our reference line. Correct? Can I zoom in? Possible? No. Okay. Now line going above this part, this is what PDW. That means okay, it's coming in a good way in the above. Okay. What about the other parameters? They are decreasing actually. So I can say in the case of liver cirrhosis, hemoglobin, albumin, total protein will start to decrease. Done. How can I prove this part? Again, go to analyze, classify, ROC analysis, go to option, select smaller test indicate more positive test. Now what will happen? All three will come above. The above will come downwards. Let's see. Continue. Okay. See, entire things has been changed. Now all three lower come in the upper part. The above one came to the downward part. Done. So I know, okay, this 3 value will start to decrease. This will start to increase. So, okay, my part is done. Again, go to analyze, classify, ROC. I will remove all these 3 important variables. Option, larger test indicate more positive test. Continue, click on OK. Now this is my graph. I can remove this part, not required. I will take this graph. Beautiful graph. Done. If I want, I can change the color also. How? Double click. You get this part on your screen. Just one click, other click. Go to this option, click on this part, change color. See, color has been changed. Okay, I don't like red color. Okay, again double click on this part. I will change to suppose green color. See, entire things change. But now it is matching with the reference line. What to do? One click, one more click. I can change to what? This color. Entire things done. Done. Close this part. Done. In the below table, what we have area. This is what your AUC. It is what 91.3%, which is above 70, which is coming very, very good. Done. It is coming significant also. If I scroll down, I got a cutoff. That is what 17.15. If you can remember, we have selected larger test indicate more positive test. We have to put while writing larger than sign 17.15. Done. What about the model quality? It is 0.86 or 86%. It should be always above 50%. Done. Okay, one part is done. Okay, now I got the cutoff that is 17.15. Now I need to look for my sensitivity as well. Okay, next table is like this 17 what 17.15. Okay, now search 17.15. Okay, here we have 17.15. So what is my sensitivity? 82%. What about my spec value? It is 0.14. Done. This is not your actual value. You have to do 100 minus 14, correct, or 1 minus 0.14. Remember this part. Sensitivity is like direct short thing. My cutoff was what? 17.15. What is my sen value? It is 82. What about my spec value? It is 1 minus 0.14 or 100 minus 14. That will be your spec value. Done, everyone? Doubts? Questions? Anyone?
Sir,
Yes.
in the practice sheet, there's no that's given to me. There's no analysis part here, sir.
I have given all this sheet to your WhatsApp group.
Yeah, that only I opened it, sir.
Hmm.
But in
Which,
that only file, home, insert, only these are there, sir. Analysis part is not there, sir.
which part you are talking about?
In the practice sheet, sir. Analyze.
Correct.
It's not there in the practice sheet, sir.
Which part is not there?
Means we should go to analyze, I think, no, sir.
Correct. Go to this part, go to classify, and go to ROC part.
Yes, sir. But
You got no?
that part analyze is not there in the sheet that is given, sir.
See, Excel will not contain the analyze part. This is
Oh,
the SPSS in which we are practicing. This is not the Excel.
okay, sir.
Then this is the SPSS, what we are using for the analysis.
Okay, sir.
Okay. Both
No,
are different things.
okay, sir.
Okay. Others, doubts, questions? Anyone? Doubts, questions for me?
So can you also go through other options that we have while we are doing analysis in ROC? Yes, after clicking this ROC analysis,
Uh-huh.
so we have other options like include cutoff value for positive classification, exclude cutoff value for positive classification
This
options.
part?
Yes, yes, yes. Can
Okay.
you go through those?
Yes,
What are
yes,
these
yes.
things? When should we
Suppose,
use those?
okay. Now suppose I'm looking at what about the ALB count in the case of liver cirrhosis. So what I will do, go to analyze, classify, ROC part. I will just reset case to state variable, click on one. I will take suppose, where is the ALB? Yes, shift, go to option, select smaller test result indicate more positive test, continue, display, select all the things, click on continue, click on OK. Now see, beautiful graph, done. So I can say, okay, I have selected the smaller test indicate more positive test. That means this is my graph for the albumin. If I scroll down, let me remove this part. If I scroll down, this is my area, that is AUC, that is how much? 80.819 or 81.9%. Done. What about my p-value? It is coming significant. What about my cutoff? It is less than 2.92. Done. So if my patient is having a albumin level of less than 2.92, they might be having what? A portal vein thrombosis. Done. If I scroll down, What about my model quality? It is 0.74 or 74%, which is comparatively good. It is more than 50 or 0.5. What about my sensitivity now? What is my value? 2.92. Okay, now search 2.92. 2.92. Okay, this is my value 2.92. So what is my sen value? It is 80. What about my spec value? It's 1 minus 0.26 or 100 minus 26. That will be your spec value. Please don't report 0.26 or 26%. It will be 1 minus 0.26 or 100 minus 26. Okay, let me make it simple for you. See, sensitivity, direct values. What about spec part? 1 minus specificity. That is why. Done?
Yes, sir.
Okay. So like if you are not sure like what is going to happen, directly apply the ROC. Automatically you will get to know about the curves, whatever we are getting above and below the reference line. And as per that part, we have to again perform the analysis with the help of appropriate options. Others? Doubts? Questions? Anyone? Dr. Prasad, you might be, if you're holding a latest version, in your ROC part, you might be getting a Udin index. Done. That value should be always close to 1. If it is close to 1, your data, your value has more good diagnostic value.
So thank you.
But it's not there for our versions. It might be there for your version. It starts with Y, that is the Udin index. You got?
No, sir, actually, like this correlation
Okay.
I'm also doing for the first time. I know the theory part because I had
Hmm.
taken a seminar for this one.
Okay. Just
But
go to display once. You got something with a Udin index.
no, sir, actually, we have the same thing. Like both of us have
Okay.
the same goal.
In the options, do you have this option? Udin index.
Where?
It's
So
not
no,
there,
sir.
no?
I think we both are using the same version, sir.
Version. Okay.
Okay.
Because in the latest version, we have this option also. A Udin index. But
I'll
okay, no
update
issue.
it
Yes, the
tomorrow
latest
by
version.
going
A
to
latest version.
this.
So like what we can do now. So like thankfully we have available calculation on the online part portal as well. So we can, if we are holding sensitivity and the spec part, automatically we can go to Safari or Chrome and just search. That's it. You will get the online calculators for the calculation part. But again, it's a complete optional part to report. No need to put your head behind it. So if you can catch up till now, then entire things are done. So like, do we have any doubts, any questions with respect to Spearman, Pearson, or the ROC part? Anyone?
Sir, one
Anyone?
small doubt, if
Ah,
I
yes.
if you would like to entertain me.
Please, please.
Sir, like yesterday you told us कि when we are confused about parametric and non-parametric, always use
Ah,
non-parametric,
hmm.
right? So similar in this case,
No,
like if we're
no. It's not about the confusion part. It's about the 50-50 part. Because automatically you're applying the data normality test. You will get
yes,
some sort of p values. Correct.
yes,
At
yes.
that point of time, if you are having a data which is 50% stable, 50% like not stable, apply down parametric test.
Okay, sir. Meaning to say कि at any point of time, always do the normality test first, and after that only put up any other test, right?
Correct.
That is the standard rule that we always follow.
Correct.
Mm. Okay, sir. Thank you, sir.
So with respect to ROC, odd ratios, linear regression, doesn't matter about data normality because they are some kind of advanced analysis. So like they don't care about this part. That is why in the correlation part, we were discussing about the Pearson part, Spearman part. In the ROC, like there is nothing. We have only one ROC. That's it. Others, doubts, questions? Anyone? Anyone? No? Okay. So like this was all about for today's class. The Spearman part, Pearson part, ROC part. So I hope you practice well now. Please practice again after this class. So tomorrow what we have is a linear regression. Or in simple terms, I will show you how to find the odd ratios and I will show you how to perform uh, Kleppner-May analysis part. One more thing, most important part. Remember, whenever we are going for the advanced analysis, like suppose ROC part, odd ratio part, risk ratio part, hazard ratio, Kaplan-Meier analysis. Remember, your sample should be minimum 30-30 in each group. If I'm going as per the textbook rules, we should have 50-50 in each group. Case versus control, you give me 30-30 patients, total 60 patients, or 50-50 patients, total 100 patients. Suppose if you are holding 40 patients overall, 10 patients in your control, 10 patients in your case group, so what will happen if I'm applying the ROC part, odd ratio part, hazard ratio part, this will show a overfitting. Done. So what is overfitting now? Whenever we are having a very small data for the upper or the advanced analysis, our model will start to remember the numbers, whatever we are fitting for the model creation. And if your model remembers the data, whatever we are fitting to it, it will always show overfitting. In such scenarios, you will get a very nice ROCs like 100% sensitivity. Your AUC will be almost 100%, like 99%, 100%, 98%. So remember this part. Never apply odd ratio, hazard risk ratio, ROC part if your data is not more than 30 in each group. As per the textbook, this is 50-50 we need, but in my practice, I'm practicing safely up to 30-30 in each group. If you have less than 30, automatically you will provide overfitting data, which is not a good practice. Remember this part. The problem with the SPSS, JAMOV, EZR, RSD is like what? It will follow the instructions, whatever we are giving, but as a human being, we are holding a nice brain, so we should know when to stop. Done? So please don't report wrong ROCs. Always ask, okay, which textbook we should refer to? I think you might know about Mahajan textbook of medical statistics. You know this book, Dr. Prasad? Mahajan?
Yes, sir. Yes, sir.
Yes, that part you can use, but
I
like you
did
need to,
gravitate search.
yes, but you need to practice a lot in the real-time data to get more amount of practice. Because in my experience, if you talk about the sample size calculation, we have a book of around 520 pages only about the sample size calculation. If I talk about the ROCs part, just the simple ROC, we have a book of 150 pages as well, just for the ROC. So what I believe, if you have access, please practice as much as possible, collect data as much as possible, practice, because every set of data will have some different background stories to look for. And that will give you more exposure compared to Mahajan and other books.
Yes.
And always discuss with your mentors. Always. Because you might practice something, you might happen something, but always cross check with your mentors. You can talk to me, you can talk to your faculties for this part. It's completely fine. So statistics is always about the discussion part. So discussion should happen. And if you believe like you are too good now for the analysis part, you can actually start your own consultations for this part as well. You can consult your PG's people for the analysis part. But for the consultation, you should be expert for the analysis. You can't take risk because one mistake can actually can cause the entire wrong analysis. So this is my point to all of you. Done, everyone? Doubts, questions, anyone? Anyone? Doubts, questions? Anyone? Anyone? Doubts, questions? All good? Okay. Then I think we can wind up now if there is no more questions. But please do have a safe practice. Practice well. Don't take risk. Consult your seniors. Consult your faculties. Consult always a senior faculty. Done? Okay. Then I think we can wind up now. What all will take up tomorrow? We will take tomorrow odd ratio, how to apply the odd ratio part, how to get the odd ratios, and I will show you how to perform the this survival part with the long rank p values. If everything goes well, then I think tomorrow we are winding up this batch as well because like entire things are covered up. I think only this two tests are pending: odd ratio calculation and the this survival part. Okay, then I think we can wind up now. Thank you so much, everyone.